issue, it may not get better, is diagnosed as complex regional pain syndrome. So she had an injury in her shoulder. The injury is healed, but the pain has stayed, and it swells and it turns red. And she's under the impression that she's pretty much just going to have to live with this forever. A neuropathic pain or neuro something. Because the nerves
Mhm.
haven't figured out that she's healed.
So you have someone, they go to the doctor, they can't find any causes for her pain, they label her with this, and then they're kind of out of options, right? I wouldn't get at all lost in that diagnosis. You know what I mean? The most important thing about it is that she actually doesn't have a physical problem, right? I mean, whatever her injury was is healed, right? So you don't have to deal with that. So I think of most things like this as like a re-education process, which I'm sure occurred to you, right? Of getting her body to understand what's happening. So in a way, from a yoga therapy perspective, I would think of it more as like a pranic issue. So, the flow and return of prana is not moving properly. I would first do like the sort of obvious, which is lots of, because if you're thinking about like a pranic issue, like a lot of breath connected to movement to get things moving around properly. I would assess her for muscular imbalances, all the physical stuff like that, and work with that. I would have her doing a lot of stuff. I was going to say with her shoulder, but what I really mean is with her whole body, but also with both shoulders. So a lot of times I've found, the other side, that's doing better is really important to involve it. And the way I think about it, this isn't technical, but the way I think about it is always that, it's sort of like the brain is getting the input from the properly functioning side, and you want to kind of like sort of train it that's what normal feels like, and now this could feel normal too, and that's one way to start crossing signals. So I'd probably end up doing a lot of cross patterning across her body, and then shoulder to shoulder as well, just to get that all moving around. But then incorporated into that, you'd want to sort of, with that doshic diagnosis, give her a whole asana pranayama set that's geared at balancing her in a pranic way. Right, so you'd have breathing and moving, and then pranayama definitely built in there. But then I would also pitch her on, changing neural pathways, right? So you'd want to get her into some meditation techniques. You'd want to assess her with the doshically, and see what kind of sort of trajectory you want to go on that way, and see if that helps. I mean, that's where I would start. Or it's a good like sort of example, like don't ever be afraid as a yoga therapist to work with really tricky things like that, because that's where you're most likely to have success. And I know a lot of times when you haven't seen something, it makes you nervous, you know what I mean, to work with it. But my experience has been that's where I've had like the sort of biggest successes, and it ends up being really beneficial.